Okay, so now we're going to talk about some basic therapeutic diets. What do we mean by therapeutic diet? It's a diet that might be ordered by a provider for specific reasons. So first of all, it's clear liquid. A clear liquid diet is consists of foods that are clear and liquid at room temperature. So popsicles, Jell-O does count in a clear liquid diet. Broth, clear sodas, things like that. Juices that are clear. Breast milk is considered a clear liquid because it digests very rapidly. Clear liquid diet might be used for someone who's having nausea and vomiting. It might be used when we're trying to allow the GI tract to wake back up after surgery. But a clear liquid diet should be for a limited time because it's impossible to get adequate nutrition or calories. Next is full liquid. This is foods that are liquid at room temperature. So now we can add some milk-based things like ice cream or some milk, maybe yogurt drinks, things like that. Again, full liquid diet is not going to be adequate nutrition, or it's going to be very difficult to have adequate nutrition. Full liquid diet also is more likely to be lower in fiber, so it may contribute to constipation. A puree diet is any diet that is pureed to liquid form for a patient who can't manage solids. So they can literally put anything in a blender with some liquid and puree it. So whatever diet that patient needs, if they cannot manage solids, that can be pureed. A soft diet may also be called a bland diet. These are whole foods, but they're low fiber, lightly seasoned, easily digested foods. Okay. Low fiber is the key here because that soft diet, we think soft in, soft out, but what we often get is constipation with that soft diet because of the low fiber level. Mechanical soft diet is any diet with the texture modified to minimize chewing. So someone who maybe has a severe jaw problem may be on a mechanical soft diet, and that's any food. We just make sure that it is chopped up, blended with something so that it's soft enough to swallow without much chewing. Regular diet is pretty much anything. ADA refers to the American Diabetes Association, so that's a diet specifically for patients with diabetes. So we're thinking more complex carbs, lower simple carbs, usually low-fat milks, usually sugar substitutes in sweetened foods, things like that. The carbohydrates should be balanced, and complex carbs should be use more than simple carbs. A calorie restricted diet is just decreasing the calories so that someone can lose weight or maintain weight. Calorie restricted diets, we have to make sure that that patient is getting adequate nutrients. A renal diet is for patients who are in advanced renal failure. Protein, potassium, and fluids are limited. Protein because their kidneys can't process and it can increase kidney damage. Potassium because they cannot eliminate potassium if they cannot void. So if their kidneys are not filtering out potassium, they can become hyperkalemic easily. So we limit potassium. Fluid limited, if they're not able to eliminate fluid by the kidneys, then we have to limit how much fluid that goes in between dialysis episodes. A healthy heart diet is going to be low sodium, low cholesterol, low fat. Okay, the very last section is going to be about nutritional support, and that is what do we do when someone is unable to take in adequate nutrition on their own.